Hi guys, I wanted to do an update on my heart surgery and how I've been doing. 2 days ago was Saturday, September 20th. Today is Monday the 22nd. Saturday the 20th, it would have been, or it was, 6 months since my triple bypass surgery, open heart surgery. I had it on March 20th. And sometimes I gotta tell you, I can't believe it's already been 6 months. Half a year has gone by, and I feel quite a bit better than I did on March 21st. um, when I went in for surgery, if you guys looked at my previous videos briefly, I wasn't having terrible symptoms. I did not have a heart attack or something like that. I was having some, what I later found out was unstable angina or heart chest pains. It was very, very mild. So, on a scale of 1 to 10, the chest pains that I would have were maybe a 0.5 to a 1, right? And they didn't last very long. And because they were unstable, they came and went with what I couldn't find to be any rhyme or reason. I could walk a flight of stairs and not have any chest pain. I could lay down and go to sleep at night, and as soon as I laid down, I had chest pain. I could, um, you know, walk 3.5 miles and no chest pain. But I could sit down and watch some television and I would have chest pain. So there wasn't any rhyme or reason to it. That's why it's called unstable angina. And so my point of bringing that up is the discomfort and the pain that I felt during this whole situation was really brought on by having the surgery, right? So, I mean, I drove myself to the surgery, 5 a.m., 4 a.m. on March 20th, 2025, and I felt fine, you know. Rarely was I ever short of breath. Just, angina. I didn't have any angina that day. Um, so when I talk about I'm feeling better, I'm feeling better since the surgery, because of the surgery, right? I'm starting to feel similar to how I did before the surgery, and that's unique to me because you know I really didn't have any bad symptoms of having blockages before the surgery, and so it's taken a while to heal, from the surgery. I still have what I think is angina. I haven't followed up with a doctor or anything about the chest pains, but they are even more um, uh, sporadic, right? I'm having less episodes than I did before the surgery. So that's a plus. But sometimes they are as bad as they were before the surgery. Again, scale of 1 to 10, maybe a 1, right? Excuse me. And my scale of 1 to 10 is different than yours, maybe, but just to give you an example of where I rank a 10 on the scale of 1 to 10, I've had kidney stones in the past. I've had 3 or 4 bouts of kidney stone attacks from my 20s into my 30s. My last one was in 2013, but that was, I think, my third or fourth episode since like 1995. And the heart surgery, the angina, let's put it this way. The angina before the surgery and since the surgery, if it is angina since the surgery, nowhere near the pain of a kidney stone. Nowhere near the pain. So when I say on a scale of 1 to 10, the angina is a 1, that's compared to a kidney stone attack at my 10. That's my 10. I haven't followed up with the doctor or the surgeon specifically about these few episodes of angina since the surgery, because they do seem to be becoming more infrequent and becoming less painful. And I'm wondering if maybe I'm just being a little impatient and it's not actually angina, it's possibly, just, it may not even have anything to do with the heart. It may actually have something to do with the muscles and the tendons and the ligaments and the cartilage and things that were cut and damaged during the operation or because of the operation. Because even though I don't have any daily, I don't want to call it daily, I don't have any chronic pain, haven't had any pain really since maybe the second week after the surgery. I do have discomfort, not if I'm not exerting myself. So for example, if I'm driving, if I'm sitting, if I'm walking, moving regularly, no real issues, no discomfort. I do have some discomfort sleeping on my left side, specifically my left side. My right side, not really so much. The left side though I do, and I'll show you it. This is my left side here in the video. It's right on, this is my bottom rib right here. Okay, it's right on under that bottom rib over here to the sternum, right? This is my rib here. And it does seem to be getting better. I think every week it's noticeably better or less discomfort, but it can hurt. If I were to sneeze, my allergies have been really bad this fall. I haven't had bad allergies. I haven't had allergies actually in the fall for 4 or 5 years. Probably since 2020, COVID-19. Normally I get it every spring and every fall, but I haven't had them for the last 4 or 5 years. But this year I am getting it. It's pretty bad. Anyway, sneezing, it doesn't hurt like it did right after the surgery. The first month and a half to 2 months after the surgery, to cough, to sneeze, to laugh, your sternum hurts. It hurts pretty bad. Especially that first couple weeks. I mean, it is like someone took a hot branding iron from behind the sternum, and every time you sneeze or cough, it seared the back of your sternum. It was very uncomfortable. But that, I really haven't had that problem. That pretty much went away. Obviously that sensation's gone since the sternum healed. 8 weeks, 12 weeks out, it's pretty much healed. But I can tell there's still stress there, and I don't think it's the bone as much as it's maybe the ligaments, right, and the cartilage and stuff, muscle. It doesn't hurt. I'm not in any pain or anything, just some discomfort, and that's what I wanted to give a update on. It's been 6 months. It's a nice round number. You know what happens? Where should I be 6 months after I drove myself to the hospital and paid a doctor 300 grand or whatever to cut my chest open and spread my ribs apart? How should I feel 6 months later? Pretty good, actually. Pretty good considering. I have not been exercising like I probably could. Lifting weights, even if it's machines, right? Dumbbells for sure, but even if it's a machine or something, I mean, I haven't done a chest fly or a bench press or something like that. Just moving in that motion without any weight or resistance is uncomfortable. Again, it hasn't hurt, but I haven't tried it with resistance either. So I'll be honest, I'm a little scared to do that. I don't want to rip something or hurt something and set myself back another 4 or 5 months, you know. So I think I'm going to wait on some of those exercises for maybe another 6 months. The surgeons told me that it could be, you know, a little over a year before I wake up one morning and I really don't have any more discomfort and I feel like I did before the surgery. So I'm just trying to stay patient and count my blessings and do what I can. But as far as other exercising like cardio and things, I do walk. I should be walking every day. I find that hard to do with my career, but I'm a trucker, and the timing and the weather and you know, just having a place to do it doesn't always work. But I have been walking as regularly as I can, you know, a few times a week. Put on, you know, 3 to 5 miles a day, you know, a few times a week, and I don't have any pain at all. None. No sensations in the heart. If anything, I sometimes feel like maybe after exercise, you know, doing some walking or cardio, that I can feel my heart beating more. I can feel it like beating harder, but not in an uncomfortable way. It doesn't hurt. I'm not short of breath or anything like that. I'm just wondering if, since the bypass, I can actually, it's more efficient, right? And I'm just more apt to be aware of how it beats, you know? I mean, it just feels, it doesn't hurt, or it's not discomfort. It's just, I can feel the sensation, you know? And it kind of freaks me out a little bit. It's another reminder, as if I don't need any more, or as if I needed any more, that, you know, my own mortality is on the horizon, and at any moment the heart could fail or not fail. I don't know. I don't have any control over it, I guess. But exercising feels good. I don't get short of breath. I'm not wheezing or winded. I really didn't feel like that though before the surgery either, surprisingly. Because again, if you didn't watch the first videos or know too much about my specific situation, I had 3 blockages, on the left side of my heart. Forgive me, honestly, I don't know how bad 2 of them are. Bad enough that they wanted to do a bypass for each of them. But I'm assuming they're, you know, 70% blocked or so, 60%. But the one that really triggered the situation that I needed to have a bypass was the left left main. That is 100% occluded, 100% blocked. And the plaque in all 3 spots are, it's soft. It's soft plaque. It's not calcified. You can see that on the CT scans, the X-rays. So it's fairly or relatively new plaque, right? But those vessels don't clog, or at least the left main doesn't normally clog quickly, right? Not where mine was, not where my blockage is, higher up where the vessels are a little larger, or where the vessel is a little larger. So nobody can tell for sure, but they were thinking, you know, the plaque is probably started around 5 years ago, and just took 5 years of stress and anxiety and anger and poor diet and lack of exercise and everything else that so many of us dealt with over the last 5 years for it to become 100% blocked. Why am I still alive? Because while that was becoming blocked, my heart grew 2 or 3 large, they call them robust collaterals, and the heart grew them, one, in enough time that as my left main was becoming 100% blocked, that the collateral made it from the right side all the way to the left side. 2, it's also large enough that it fed the bottom, below the left main. Below the blockage in the left main to keep me alive, to the point where, I had no idea I was having a problem with plaque or blockages, none whatsoever. Other people have, symptoms way before it's 100% blocked. Usually, if a vessel becomes 100% blocked, it's because some plaque, soft plaque usually, it's more unstable, has ruptured or broke loose further up in the stream and floated down, and that size of plaque, that bit of plaque was, stays the same size, and it goes downstream, and as it goes downstream, the stream gets smaller and smaller, narrower and narrower, right? And it would get wedged in a spot, and that's where you'd have your heart attack. That's where somebody would, start to have their major symptoms. I didn't have that. The plaque didn't break loose. It didn't go downstream, and my heart grew collaterals large enough and quickly enough. It grew collaterals large enough that it kept me alive, and to the point where I really, other than some unstable angina, and again very mild in my opinion, started last spring, and it was very infrequent. I didn't know I had a problem. The unstable angina is why I went in and got tests done and got looked at. I checked myself in the emergency room. And you can look at the other videos and learn more about that. But anyway, the most pain I've had since all of this, including the angina that started last year, is from the surgery. The surgery was the most painful. And it was scary to go do it. It was mentally, but also emotionally, and obviously physically traumatic. Very traumatic. And my surgeon did a good job, though, and God bless him. He put me at ease. He has a lot of experience, 25 plus years experience. He is not only a heart surgeon, he's a heart transplant and lung transplant surgeon. So I felt like I was in good hands. I did have, after he got in there, and while I was in the intensive care unit, ICU, he came in to visit me, and he told me that he didn't know this with imaging up until the surgery, but once he was physically able to put his eyes and hands literally on my heart, he could tell that I had what he thought was a mild, I don't know if that's the right word, mild, but a minor congenital anomaly, in that the left, the left side of my heart, the vessels were or are much smaller than he would expect for someone my age, an adult male. They're smaller. And the right are slightly larger, not too large, not might cause problems or something for me. He's like, oh, you're just kind of right dominant in that the right side of your heart, the vessels are larger, and with those collaterals now that have grown, we think, over the last 5 years or so, since the plaque started developing or accumulating, that the right side just has always kind of compensated for the left. He actually said that he had a difficult time grafting the 3 bypasses to the left side because the vessels were so small. Not the grafts, but where he was going to connect them to, where he was going to graft the arteries and vein to the heart. He said, but he was successful, and since then, a month out or so, I had a minor complication. I had some inflammation in the body, and fluid was building up around my heart, things like this. So through some other imaging and CT scan and things, they did confirm that the vessels that he grafted took, right? They weren't leaking, they weren't weeping, they were working. So I'm thankful for that. I don't think I have any complications there. And with, some minor stress from exercise and things like that, vessels can grow, the heart muscle can get stronger and stuff. So, he told me that he thought I could easily have another 30 or 40 years of life if I don't get into an accident, or, if I change my diet and lifestyle, that things should be okay. So I'm excited about that. That's kind of that is the update. Not kind of, that is the update. It's been 6 months, and I'm feeling pretty good. I've been back to work for over 2 months now. I kind of baby step. I'm self-employed, so I was able to take as much time off as I wanted, and I kind of baby stepped myself back into work. And I'm glad I did, because I feel even better now than I did 2.5 months ago when I first went back to work for a few days. Even wearing a seatbelt now it doesn't bother me. It was like wearing a seatbelt with a pretty bad sunburn. That's how it felt for at least 3 or 4 months. The skin, it's my left shoulder, the skin, right? It's still sensitive, but nothing like it was for the first 3 or 4 months. I mean, it was uncomfortable to have a seatbelt on. It really was, just to touch it, let alone a shirt or a t-shirt or something like that. Like this, having a shirt on now doesn't bother me. It did for the first few months, but it doesn't bother me at all. Every week, the left side here, where they took the mammary artery, disconnected it and moved it over to my heart, the one end over to my heart. They have this, he said scrape, the surgeon said scrape, I guess that's what they did. They disconnect it from the back side of my pec, my muscle, right? So it's not just cutting the artery and moving it over. That artery is, connected to the back of my pec muscle. And so they had to scrape that off so they could move the one end over to where they wanted to graft it onto the heart. And where that was connected, and where that scraping I can imagine was is still numb. I'm getting more and more sensation back though every week. Excuse me, but that was painful for a good month or two. Just kind of ached, right? But then the skin, just the surface, the nerves. Boy, I mean, I didn't want to wear a shirt. I wore a button-down shirt, no t-shirt, unbuttoned down to my belly button. That's what I wore. That's what I slept in. That's what I sat around the house in for over 3 months. And I would just sit there and open this up so nothing touched that incision or where that mammary artery had been scraped, because this was like, at first it was like on fire, right? And that lasted maybe a week or so. That went away pretty quick. But then it was like a sunburn, like a bad sunburn. And I've had bad sunburns. And to me, that's what it felt like. You just don't want anything touching it, It didn't hurt. It was just a reminder and uncomfortable. So that's all but gone away. I mean, I can wear a shirt, obviously. I'm wearing one now. I can wear a seatbelt, obviously. I drive a semi-truck, and I always wear my seatbelt. And the car, too. I don't know if there's anything else that I wanted to update anybody on. I just wanted to, if I may, I want to say, bear testimony. I feel impressed to do that. Charlie Kirk was assassinated a week and a half ago, almost 2 weeks ago. Lots happened in the culture since then. It's been a wild week and a half. But it got me thinking about some things. And, I feel impressed to just share with anyone who might have gone through this surgery or something similar, valve replacement or a transplant or something like this. Or somebody that is going to have to go through it. Maybe you're a couple days out from your surgery date, or you're going to have to do it in the next 6 months or something, and you're freaking out a little bit about whether or not to do it. I want you to know that, at least in my experience, that these doctors and these hospitals, when it comes to procedures like this, are extremely educated and talented and skilled in doing these procedures, to the point where they can sometimes come across as it's totally routine, because guess what? It is routine to them. It's what they do all day. My dad has always said, you get good at what you spend your time doing. And many of these people have spent a lot of time doing these procedures. And they're good at it. The technology is there, and the odds are in your favor that not only are you going to survive it, you're going to thrive afterwards. You're going to be fine. It is traumatic, mentally, emotionally, and physically. But after, 8 hours, 10 hours, however long it takes in your condition or in your situation, you're going to come out of anesthesia. It's going to be a little scary because, you may not know where you are. Maybe you will know where you are. I did, but you won't be able to speak because you got a breathing tube down your throat. And you're fighting the machine, and the machine's trying to breathe for you, and you're trying to breathe for yourself, and you got a whole room full of nurses and doctors in there who, by the way, aren't there by happenstance. They are there waiting for you to come out of anesthesia, right? You're not going to be left alone in there, and you're not going to wake up by yourself. You're going to have a team of people in there specifically waiting for you to start coming out of anesthesia so that they can help you and remind you where you are and what's happened, and make sure that you can breathe on your own so they can pull that tube out as soon as possible. And these are after the surgery, after the procedure, and you start coming out of anesthesia. You're just gonna have a couple. You're gonna have several little milestones, right, in the first 48 hours of tubes coming out, breathing tube coming out, needles coming out, wires coming out, tubes coming out, and you still got a catheter inside you. You got drainage tubes coming out of your abdomen. You got your arm. For me, it was my right arm. It's going to look like a pincushion. It's been poked so much for blood draws and injections and IVs and all kinds of stuff. And not to mention the incision is going to be, uncomfortable. I wouldn't call it painful. You're going to have some oxycodone, and some Tylenol or what have you, and you're not going to be in a lot of pain. You're going to have discomfort, but you can do it. You can absolutely do it. And hopefully you have friends and family like I did who will be praying for you and fasting for you and thinking about you and being concerned for you and coming to visit you and holding your hand and giving you a hug and helping you reach for this and go get that and stand up and sit down and stand up again, because you're going to be helpless when it comes to that. You won't even be able to get in and out of your chair by yourself. And that's okay, because it may seem a long ways away, but in about a month, you're going to be getting in and out of the chair by yourself easily. That's fine. You'll still have discomfort, but you're going to be much more autonomous. Give yourself 3 weeks to 4 weeks. You're going to be much more autonomous. And then another 2, 3, 4 weeks after that, 2 months out from the surgery date, you're going to be, oh my gosh, I hope everybody just goes home. I can do it on my own now, okay? Now I just need to be patient, and I'm off my pain meds, and I got to do my walking, and you'll have the shower routine down, which, by the way, I was terrified about. Turn the shower head to a drizzle, and get in there and get yourself clean. You just dab and lightly scrub. You're not doing anything, so you're not that dirty, but you got to get up and you got to put on clean clothes, and you got to get outside and walk. Walk to the end of the street, walk to the end of the sidewalk, go around the block, and by a month or so, you're going to be walking a mile or two all by yourself if you want to. Bring your nitroglycerin with you just in case, but you're not going to need it. I've never used any of the nitroglycerin tablets my doctor prescribed me. Last fall, he prescribed it to me leading up to the surgery. He said, you might want to carry these around. Here's how you take them, and I've never had to use them. It's fine. But you're not done yet. You're not done yet, and that's my point. That's why I want to bear witness to you. You're blessed enough to have this problem in this country. You're blessed enough to have this problem and to be dealing with it where you have access to the hospitals and the technology and the expertise and the experience and the talent and the skills. And frankly, hopefully you have insurance, and you have access to all this. Use it. This is not the end of the world. It's going to set you back for a year. It is. And you're really going to feel it for the first few months. But I look forward to the day where I wake up in the morning like the surgeon told me, and I don't think about it, So you're going to be okay. I pray for you. Be strong. Take the medication. Oh, and I want to say this. Go to the rehab. Go to the cardiac rehab. Most insurance companies will pay for like 30 sessions or so after the surgery, and you need to go. You need to go. for a couple of reasons. One, so you can be monitored while you incrementally increase your resistance and your capabilities. So for example, if you're getting on a treadmill and you're just walking at, you know, a speed of 1, right? Because you don't want to trip or something, and you know, you're too weak, your sternum isn't healed yet, you can't be holding yourself up if you were to fall or something. So you're just very carefully moving your limbs and walking. They're going to be studying and monitoring your blood pressure and your heart rate and some other things, right? And you're going to want to begin to rehabilitate while being monitored. Okay, so that's the big reason right there. So go to cardiac rehab. The nurses are, at least in where I went, they're excellent people, and talented and skilled in being friendly and kind and caring, but they also know what red flags to look for, if any. And as a matter of fact, that's how I found out I had inflammation and therefore fluid buildup around my heart. If I had not been at cardiac rehab, when the nurse brought it up to me, she said, something's not right here. I don't think your left lung is opening up or inflating all the way. Are you having any other symptoms? I said, yeah, I've been coughing, you know, a lot. And I'm not a cougher. I don't smoke or anything like that. And man, I mean, I couldn't exhale without coughing. I couldn't finish a sentence without coughing 3 or 4 times. It was annoying. This is within the first, well, 2 to 3 weeks of the surgery. I thought I just wasn't being patient enough. I thought it was totally normal that the cough and not being able to catch my breath, take a full breath in. Every time I inhaled, I wanted to cough. Every time I exhaled, I wanted to cough. And I did. And you know, it was the second day I was at cardiac rehab. I was the youngest person in there at age 49. And I'm the only one hacking up a lung. Like, I felt, physically I felt okay, but my respiratory system, it was exhausting. I couldn't breathe. I couldn't talk. I had to cough and cough and cough and cough. And I thought to myself, what is going on here? Am I just, you know, do I just have to wait a little longer? Or, you know, how come all these other people have been in here and they're older than me and they've had other problems going on and they seem fine? But that nurse, it was on my second or third time there, that the nurse said, I think you need to contact your surgeon, your doctor's office, and you need to schedule a CT scan. Something's not right. She had the stethoscope, you know, on my lower back, and she said, I don't think your left lung is opening all the way, and I'm not sure why, but I don't think it's inflating all the way. I said, well, I don't feel like it is. I can't get a breath in without hacking. Long story short, that afternoon, I got a hold of my doctor. The next morning, I was in for a CT scan, and that led to an echo, which led to confirmation that, oh, you've got a major problem here. You've got a complication, and that is your inflammation